We've been passing it out since 2005, and it wasn't legal then, and so we would basically buy it off the black market, like diverted. And we'd seen some kids that were living in a squat in Hollywood. It was this old rundown motel, and a bunch of them kept dying. And so we bought this stuff, we trained them, and then they stopped dying. So we just kept getting it, and we'd give it out, and we'd be like, "Don't tell them where you got it if you get pulled over by the cops." Yeah. And they were really good about it. You know, we saw this. We were on outreach. We saw some kid get pulled over by the cops, and we didn't. He got put in the car, and like a week and a half later, we saw him. He's like, "I didn't say anything, dude. I didn't say a word." Now it's legal. And so we buy it from Pfizer. We buy the injectable kind. We also get it from, I forget what the other company's called. They do the nasal stuff. We don't get a lot of that because it's really expensive. We also get it from this company called Calio. And Calio has it's kind of like an EpiPen sort of thing. Yeah, but it's really expensive. It's like $3,500. So nobody buys it. They can't move it. It's just sitting there in a warehouse. So what they do is they just started giving it out to meal exchanges. And to make like an 85% profit, it's fucked up. They should just be giving it out. Yeah. Yeah. I think I don't know. I mean, we don't charge for anything. And I don't think they should charge for that if they're prescribing opiates to people. They should be providing with training. They should be providing with the naloxone just in case. They should be showing them how to store their opiate. It was a big month if we passed out like 50 before, because we didn't have much. Now I can pass out that much in a night. I just picked up 500 doses today. It won't last. It'll probably last a week. So we have a big mobile unit, and we just drive around and we park at certain spots, certain times. Everybody knows we're going to be there. So we would go talk to all the sex workers and ask them where people were doing dope and where they were buying it. And somebody was like, "There's a shooting gallery over there," and they told us the address, and we went over, and I remember like knocking on the door. I'm like, "Hey, what's it?" They looked at us like we're crazy, and then we're friends with them now. We do trainings there, like the neighborhood comes and sits on the porch, and we show them how to not overdose or how to not get hepatitis. It's every day. We also do them for other agencies. There's like all of a sudden all these healthcare providers are concerned about liability issues because they prescribe opiates, and so we'll go train their staff, or we'll go to like a Skid Row Housing Trust and train their staff or train their residents. So I think those trainings should be available to anybody, and especially when you consider how many people are active drug users. Everybody knows one. Everybody knows somebody who's using opiates, so everybody should have this shit just in case. Like when we didn't have any, we passed it out specifically to people who used opiates. At this point, we just give it to anybody who'll take it. Our overdose rates have gone up about 15% in the last couple months, but no, the fatalities haven't gone up. Just people overdosing because we give out so much of it. I don't want to see anybody die. I mean, it's the same for all the programming we have. People do drugs. This affects a life. If they're going to stop, they're going to do it on their own when they're ready. So there's no point in penalizing them by denying them access to healthcare. There's no point in treating them like shit, Just give them some information, give them some supplies, and they don't want to die. They don't have a death wish. They just want to get high.